Good morning. Good morning. Good, better. 30 years ago, this past weekend, an East German politician was in the middle of a rather dull press conference about the loosening of travel permits to the West, when a journalist pressed him about the timeline for these new measures to take effect. His response? Immediately and without delay. A small handful of activists in East Berlin heard these words and trekked to the border to try their luck. Soon they were joined by a few others, then more. Within hours, thousands have gathered at the checkpoints at the Berlin Wall and dismantled in a matter of days a barrier that had divided the world for decades. The rest is history. As we approach this morning's summit, and I read the trenchant commentary on this momentous anniversary, including by Johns Hopkins School of Advanced International Studies professor Mary Cerroti. You know I had to get a little bit of a commercial advertisement in there for the university. She wrote the definitive study on the wall's demise. And I was reminded of how swiftly change can happen when people act deliberately and in concert. Seemingly insurmountable impediments to human flourishing can be tackled, be they brick and mortar barriers to freedom or devastating and wrenching epidemics. But we know too that even these challenges that appear to be resolved swiftly, like the final destruction of the Berlin Wall, are in truth the culmination of years of unwavering persistence and driving vision. Most require a combination of carefully articulated ideas and dedicated individuals willing to put these ideas into practice to create lasting change immediately and without delay. It is this very ethos that animates the Bloomberg American Health Initiative as it seeks to respond to the complicated, intertwined, and seemingly irreversible public health crises of our time. Systemic violence, obesity, environmental degradation, challenges to adolescent health, and addiction, particularly the rampant and devastating explosion of suffering and death from opioids. We see this spirit clearly in the ambition of the initiative's mandate, in the scope and in the impact of its research and its education of public health practitioners who are doing the difficult and essential work in the field and on the front lines to build the institutions and partnerships that give all Americans the opportunity to live healthy and fulfilling lives. And over the past 3 years, the work being done in clinics and in neighborhoods is clearly moving the needle. It is remarkable how quickly this initiative has progressed. It's evident in the overwhelming response to the articles in the initiative's 2018 issue of Public Health Reports, which have been downloaded over 10,000 times. It is evident in the pioneering forecast study, which demonstrated how low-cost drug checking can help prevent deadly fentanyl overdoses, and in the advocacy for extreme risk protection order laws, which are helping to prevent those most at risk of violence from accessing firearms. And it is evident in the initiative's Bloomberg Fellows, a growing cadre of individuals deeply embedded in community organizations and poised to take advantage of knowledge gained from and share with faculty and fellow students and put them into use immediately and without delay. Of course, though, none of this would be possible without the support of Bloomberg Philanthropies, an organization that exemplifies what it means to set the highest goals, marshal the best people at the right institutions, and set into motion solutions that break down barriers and set us on the path to building a better world. Whether the issue is gun control, whether the issue is climate change, whether the issue is violence, whether the issue is addiction, Bloomberg Philanthropies has been at the leadership of efforts to galvanize individuals, leaders, institutions to make change in this country and abroad.